Hello. I get this question a lot. Why my blood pressure going up despite medication? So if your blood pressure keeps creeping up, even though you're taking medication exactly how it's prescribed, and that can definitely be hard despite side effects that most people can experience. But you're like, my doctor told me to take this. I'm going to take this. Well, this message is for you if that is you. Say you started on one pill and you were told, yes, you just got to get on this one pill. Your blood pressure is going to get better. It's going to control everything. And then your numbers still went higher, just a little bit, a little higher. So it was like, okay, let's just increase the medication a little bit for you. Okay. Then it kept going higher. And you got another medication was added. And then maybe even a third. And you may be wondering, why is this still happening? It's not that you're failing. Your body is communicating. Okay. So blood pressure is not random. It is not it's not stubborn for no reason. Okay. It's not random. It's not stubborn. And it's responding to something that's happening deeper beneath the surface that you may not see. And so when we check our blood pressure, it's really an indirect blood pressure, but it's something that's going on deeper. Okay. So today I want to explain what that something is, and more importantly, what you can do about it. Okay. So I see this pattern again all the time. A person is diagnosed with high blood pressure, or what we call hypertension. And 90% of the time, we tell them is essential hypertension, which we know no reason of why you have high blood pressure. And most of the time in traditional medicine, that is true. You have no idea why that is. And there's a few cases that there's secondary causes of high blood pressure or hypertension. And you may have those risk factors. You can talk to your doctor about that to see if there's another reason why that you may have high blood pressure. But say for some reason it's just like you're in there, your blood pressure is high, and we're going to start you on a medication. And what are we going to start you on? We're going to start you on a medicine like lisinopril, okay? And at first you see, okay, yes, this is working. The numbers are improving. I have this little cough, but it's not too bad. So I'm going to keep taking it. But then 6 months later, the blood pressure starts to rise again. And so you may have started on like just a small dose, 5-10 milligrams, and like, oh, we need to increase that to 20. Okay. Then the blood pressure is still going up. And now we need to add in another medication like amlodipine or metoprolol. And somewhere along the way, no one paused to ask you, like, why is this blood pressure still going up? No one looks at that. They're just like, your blood pressure is going up, the medication must not be working, or you're not doing what you're supposed to do, so we're just going to keep adding in more and more medication. Okay. So medication lowers the blood pressure by force. Okay. But if the internal environment, the terrain of your body stays the same, that force has to keep increasing. So you have to keep increasing that the pressure that goes to your body. So the medication has to keep increasing. So that force has to increase to get over it. Okay. And that's the escalation pattern. And this leaves people so frustrated and confused. And they're like, oh, I'm just not going to take this medicine. Like, this is not working. You're just adding on more and more. And I see this a lot, unfortunately, when I was doing primary care. But it was like, oh my gosh, I understand. And even in my like own family, they're like, oh, I thought I was supposed to stop taking that medicine because they gave me this one. I was like, nope, your blood pressure was going higher. So they just like, let's add it on. Okay. And I forgot to mention that if you have questions along the way, please put them in the chat. So I can look at those along the way. So if you see me looking down or to the side, that's what I'm looking at to see if there's any questions that come up. Because again, I'm coming on here to actually help educate you, to actually learn more. So if something doesn't seem clear, please ask questions and I'll come back if I need to, or if I see them live, I'll answer them live. Okay. So yeah, definitely look that. And while we're at it, go ahead and like the video and share it with your friends on Facebook, family members, YouTube, wherever you are. Share this video so more and more people will learn about their blood pressure. Okay. All right. So again, let's see. Blood pressure is not a problem; it's a signal. Okay. So it's most of the time called the silent killer, because sometimes people are like, I don't want to take this medicine anyway because I don't feel bad, and they just want to keep me sick, so I'm not going to take it. Okay. Again, silent killer, because you don't see it on the outside. It's something deeper, okay? So it's reflecting on what's going on in the inside of your body. So you want to actually really pay attention to your blood pressure, okay? So here's what your blood pressure is responding to. Number one, it could be it's responding to vascular stiffness. So I've heard this when I was younger, like, oh, as you get older, your arteries just stiffen, and so your blood pressure is going to go up. So that's just a natural part of aging. What happens is most people's arteries start to stiff because they don't make changes, and it starts to have our blood pressure increase, and that's happened as we get older. And even when we look at this in medicine, we're like, oh, well, they're 70, 80 years old, we'll let their blood pressure go higher. But that's not necessarily because their risk is higher. Their risk is not higher for like stroke and things like that we'll talk about. But it's like, oh, we want to make sure that the medications themselves are not going to cause more side effects to where they're falling and dizzy. But it's still not a normal part of aging, and they're still now being a little bit more strict with blood pressure, even as you get older. Okay. So again, vascular stiffness. Arteries, healthy arteries are actually flexible. Okay. They expand with each heartbeat. But because the inflammation from like the processed foods, the salt, the excess animal fats, and that just causes our vessels to become stiff. So if their vessels are stiff, goes back to like my physics time. So if it's stiff, then higher pressure has to go through the vessels, and that causes your blood pressure to increase. So again, the way you check your blood pressure is to check to see how flexible your arteries are. Basically, like they squish down and then they slowly let go, and that's what your blood pressure is checking. Also, it can be due to chronic inflammation. And if you've seen any of my videos, you see that I talk a lot about inflammation and how it's like the underlying issue for almost every single chronic illness that's out there, okay? So it's that low-grade inflammation that damages the lining of the arteries. And when those arteries are irritated, the blood flow becomes turbulent and the pressure rises in as a compensation. So that's another reason. Sodium handling. So it's not just salt, but it's the balance between the sodium and the potassium. So if you ever look at like your blood test numbers, you'll see like they have a sodium level and potassium level, and going back biochem, things like that. But anyway, your body likes a balance. It doesn't like too much of something and too little of something else. Okay. So in processed foods, the sodium is very high and the potassium is low. Most people are like, well, my potassium is low. It's only like 3 or 4 in my blood, but that's because the potassium should be inside the cell, not outside the cell. Okay. So, but your body still needs that balance between sodium and potassium. If it doesn't have that balance, then it causes a fluid trap, and then that causes the increase in the blood pressure. Okay. Then, of course, we have stress and the stress hormones like cortisol and adrenaline that really tightens up the blood vessels. Okay. So this chronic stress, just like the chronic inflammation, keeps the blood pressure elevated. Okay. So your nervous system always feels like it's in a fight or flight mode. It's like, am I running like a saber-toothed tiger coming after me, or whatever may be going on? Something's coming after me, GFR, whatever. But the blood pressure then rises accordingly. And then if that's a chronic stress, then that's always elevated. Like your blood pressure is always going to stay elevated. Okay. And then you have your sleep quality. Okay. So many things. And shout out to my sister, Aja, Dr. Aja Gilmore Nichols. She's a dentist. She talks a lot about sleep and how it relates to like your dental stuff, and how sleep apnea can actually cause issues with your heart, which we definitely know that can be the case. So undiagnosed sleep apnea, that is one of the secondary causes of high blood pressure that you may need to look at. So if you stop breathing at night, you snore heavily, you may want to get a sleep test to see if that's causing an increase in your blood pressure. But this causes, if you have that, causes undiagnosed sleep apnea, causes spike in your blood pressure overnight. And if it's not treated, it can cause a lot of damage, pulmonary hypertension, things of that nature. So you definitely want to look at that. But even if you don't have sleep apnea, poor sleep quality actually increases the sympathetic nervous system activation. And again, causing us to be in that fight or flight mode. So you want to make sure your sleep is good. You want to have the restorative sleep. You want to make sure that you're sleeping at least 8 hours a night. And getting that restful sleep. Okay. It's not just because you're tired, but there's a lot that goes on when you're sleeping that the body is doing and repairing. Okay. So sleep is definitely important. If we weren't supposed to sleep, we wouldn't be made to sleep. Okay. So just so you know, people. Next thing could be weight distribution. So it's not just the number on the scale, but the way that your body weight is distributed throughout your body. So a lot of what we will be concerned with is what we call central obesity, which is a lot of fat around the abdomen area. And that's could be definitely visceral fat, and it's metabolically active, and it produces a lot of inflammation and chemicals that increase the vascular resistance. And again, that's science language, but that's, again, keeping the blood pressure high, keeping those arteries stiff, making that pressure, making it harder for the blood to flow, and increasing that pressure so it can get through and actually bring nutrients to your body. So you want to make sure that you look at that. And if you have what they call my family, I remember at family reunions, they're like, oh, I got that spare tire, and that's that visceral fat, that central obesity. So we want to be very cautious about that, and that's usually related to diet. Okay. The next thing would be insulin resistance. So high insulin levels. And if you saw my video last week or before, depending on when you're watching this, is we talked about diabetes and A1C, insulin resistance, and that actually can cause your blood pressure and your blood vessels to stay stiff, and cause your kidneys to retain sodium, which we already talked about, how sodium causes issues with the inflammation. And again, that insulin resistance stimulates the sympathetic nervous system. It causes the arteries to become stiffer. And so when the blood pressure rises, your body is responding to either one or more of these drivers. Okay. So you want to look at all these different aspects. And these are things that you can look at yourself. You can talk with your doctor, especially if they do a lot of lifestyle medicine. They're really looking deeper into these things. So you're like, what am I not doing of those things that maybe I should, kind of adjust? But we'll talk about that a little bit later too. Okay. So again, medication is meant to lower the numbers, but the drivers that we just talked about remain. So the underlying cause, the medication is not fixing those. It's just to push that pressure down. Okay. So it may falsely look like you're getting better. Okay. So let's be clear though. When I talk about this, people are like, so you don't like medications, do you, Dr. Amanda? So many patients come in, it's like, I'm coming to you because one of my friends said, you don't really like medicine. So I don't want to be on medicine. So what can we do? No, I am not anti-medicine. Medicine definitely has a place, especially with blood pressure medicine. Like I said, it's called the silent killer. And most time when we come in and we check your blood pressure, again, it's an indirect way of checking your blood pressure. And we do not know what it looks like on the inside at the time. Okay. So blood pressure medicine definitely can save your life. Okay. Bringing that pressure down, it can reduce your risk of stroke, reduce your risk of heart attack. It can protect your kidneys, so it doesn't cause your kidney failure to end up on dialysis. Okay. So if your doctor recommends medication, despite going through these other things, or even if it's very high, they may be like, okay, we need the medication plus make these other changes. Okay. So don't be so resistant to initially medication if they're actually talking about the underlying drivers also. Okay. Okay. So we want to treat the pressure, and they want to treat the pressure when we the medications that we give. We got to get this down because we want to reduce those things. Okay. But again, it does not transform what's going on the inside. It does not decrease inflammation. It does not, the insulin resistance will persist. The stress physiology stays elevated. The visceral fat continues to accumulate because it's like a vicious cycle with the inflammation. And then you have more fat, and then it causes more inflammation, and you store more fat. And it can just be very, very disheartening and discouraging at times. Okay. But again, we're here to encourage you. So don't get discouraged. Make sure you listen to the whole thing. If you don't have time now, come back and listen to it later. You can rewatch it several times. You can also, I posted on my YouTube channel, so you can actually watch it there. You can go back and watch some of the other videos, even though it's not going to be live here. So all the time. So you can do that. So if you need to rewatch it, really listen to it, see what's going on, put in your questions so we can answer that. Okay. All right. So when these things happen, again, the visceral fat accumulates. We want to make sure that this is actually not going to continue. But again, we have to look at what's going on. So you imagine like this, trying to hold down a spring. Okay. If the force underneath keeps increasing, like you keep trying to press it down, but for some reason the force of the spring is coming up, you have to put more and more pressure to keep it down, right? So that's what happens physiologically. That's why people feel like their blood pressure is out of control, even though they're compliant with the medication. Okay, so you're trying to keep it down, pressing down like a spring, but the inflammation and things just keep pressing against that. And then the medication continues to rise because you got to keep that pressure, keep that force going, that counter force. Okay. All right. So high blood pressure, we usually talk about it during heart month. It is not just a heart issue, though. It is a vascular issue. It's a metabolic issue. It's a stress issue. It's a sleep issue. It's an inflammation issue. Okay. We talked about those things earlier. But when we zoom out and we stop chasing the numbers and start restoring the system, then our body is designed to do remarkable self-regulating mechanisms. Okay. So when we reduce the inflammation, it improves the endothelial function. And the endothelium is that lining of your artery. So it is very important to keep that intact. So you look at it like your skin. Your skin actually is like that, but it's on the your endothelial lines on the inside and the arteries. But if you're like you have a break in your skin, just like you have a cut, you know how that like hurts, and you see that it's trying to heal. Well, that's what's going on in your arteries when every time you have like unhealthy diet, you're not exercising, you're not sleeping well, it's giving those hits to that wounded place. Like if you look at your skin, if you have, like I said, a cut and you just keep hitting it, it's never going to heal, right? So that's what's going on the inside of your artery. So we want to make sure that we are reducing that inflammation, we're reducing and we're improving that endothelial function so we can restore the insulin sensitivity and calm down our nervous system, okay? And our blood pressure will naturally trend downward. How about that? If we give our body what it needs, it actually will respond, okay? So we want to think of a plant-forward nutrition, okay? I was about to say diet, but I hate trying to use the word diet because that's usually a negative term for most people when I think restriction. And plants are powerful. I love talking about plants, and we want to look at, they actually have a special dietary pattern for high blood pressure, and it's called an acronym DASH, Dietary Approach to Stop Hypertension. They also have, the Mediterranean diet and shown to consistently lower blood pressure. But if you look at it, it's mostly plants. And actually learned that in the DASH diet, they kept in, some meat and dairy because they were like, oh, no one in the U.S. is going to completely cut out those things, even though they know that the animal fats that are found in those foods can still cause that inflammation. They just didn't think people would give it up. So they kept it in there just because they didn't think you would give it up. But if you can decrease it as much as possible, you want to try to do that. Okay. Again, the more you move towards a predominant plant-based eating pattern, the better you'll get. Okay. So what does that look like? It's increasing the potassium, it's increasing magnesium, it's increasing fiber. It improves the nitric oxide production, which actually helps dilate the blood vessels a bit better so they're not so stiff. And it reduces that oxidative stress, okay? So what helps with that? Of course, leafy green vegetables, leafy greens. I love leafy greens. So if there's one food that you make sure you eat every single day, it would be leafy greens, okay? The dark leafy greens, okay? You want to eat that every day. And so that would also include things that help with the blood pressure would be beans and lentils, blueberries, like flax seeds. These these foods you can look at as vascular therapy. Okay, so food is medicine. Okay, and like I said, when nitric oxide is produced and it improves, it actually dilates your blood vessels naturally. And again, that's what we want to do. We want to decrease that stiffness in the blood pressure. So what we want to, or I already talked about, we want to make sure the sodium potassium level are balanced. And actually, potassium balances sodium, so we want to eat potassium rich foods. And I always put a caveat in here with this is that you want to be careful, especially if you told you had kidney issues, that potassium, too much potassium can overload the kidneys because the kidneys regulate this system. So be cautious with that. But foods like spinach, sweet potatoes, white beans, avocado, they're rich in the potassium, and that can actually help reduce your blood pressure significantly, even alone. But of course, we want to do it all in conjunction. But the foods have a very powerful, they can be very, very powerful if you continue to eat them. But they're not like you can eat it once and don't have to eat them again. And you're like, I don't, I'll eat, a leafy green salad today and tomorrow, and my blood pressure should be normal. That's not the case. We got to repair that endothelium. So don't get discouraged if you had one or two meals, a couple of weeks or something like that, and you're like, my blood pressure still not going down. It may be related to the amount of damage that's already in your blood vessels. Okay. So continue on. I'm here to encourage you. It is working. Remember, it's deep inside, underneath, that you may not see at surface level. So keep going. Okay. So what else can we do? Weight distribution. So we talked about how the midline central obesity can cause issues. So we want to try to decrease our weight by 5 to 10%. And this can increase our insulin sensitivity because we don't want to stay insulin resistant. This helps with the vascular compliance. This decreases the inflammatory markers, so we're not storing more fat and then continuing on that vicious cycle. Okay. Again, this is not about a number on a scale or being thin. It is about healing, metabolic healing. Okay. So we want to be very cautious with that. And I already mentioned this, but we talked about sleep. And if there's a concern that you may have sleep apnea, or if you continuously have more and more medications added for your blood pressure, you may consider asking your doctor, should I get a sleep study? Okay. Something that can be done very easily. They just check and see if you stop breathing at night. And then if that's the case, then of course, there's treatment for that. And again, Dr. Aja Gilmore-Nichols talks about a lot of treatment options for sleep apnea. So check her out if you have sleep apnea. Okay. And like you said, treating sleep apnea will not add more medications. Of course, we'll just treat the apnea, and then that will actually help get you better. What else? Stress. That's right. Stress philosophy, or stress physiology reset is what we want to do. And what can we do to that to bring down our stress level? So every single day we have to practice something that decreases our stress level so it doesn't build up, because usually it's just a small little hit over small little hit over small little hit that causes the increase in stress. So we want to make sure we're doing deep breaths, because when we are stressed, we usually breathe shallow and we don't really open up those lower lung fields. So we want to take good, long, deep breaths throughout the day. Okay. So you may want to do that now. Okay. So deep breaths. Resistance training actually helps reduce our stress. Okay. So not just walking, but actually doing something that lifts those weights. Okay. Also, spiritual grounding, like prayer and meditation, which is so good for me. I can say that is does wonders for stress on a daily basis. Okay. Being outside in nature. So like when you see me walking, it's usually I try to get outside because if it is not pouring down raining, I do walk sometimes in the rain. And you can too. Because my pastor said you only get wet once if you're out out there. But being out in nature, actually having that exchange with the nature actually helps decrease our stress. It has that symbiotic relationship that can help out so much. Okay. So this is not soft medicine. This is not something that's like crazy out there. This actually, this is an autonomic nervous system regulation. Okay, so we want to decrease that sympathetic nervous system, and then go to that calm and relax state. Okay, so if you are someone that you're like, okay, I need a plan to restore this physiology and not just suppress your numbers. You're like, don't forget, Dr. Amanda, your girl here, is a lifestyle medicine physician and actually do virtual medicine appointments. So you can actually reach out to me if you're like, your doctor just wants to add more and more medications, or your doctor's like not comfortable or doesn't have time to discuss the underlying things with you. Definitely I can and actually help, and we can work in conjunction. We can work as a team between me, you, and your primary care doctor to actually help bring your numbers down, not just with forcing medication. Okay. So imagine you do that and you're like, okay, I've been working with Dr. Amanda and now I'm going back to my doctor. And you imagine going back to your doctor and they're like, hey, your blood pressure has been consistently lower. Yeah, I think we should lower your medications. We're not adding any more today. Not because you stopped it abruptly, not because you ignored medical advice, but because your body really no longer needs that pharmaceutical force. Imagine that. And not only that, but you can't see, but you feel lighter because one, you can imagine that your blood vessels, your arteries are more flexible, more pliable. They're moving around more because you're sleeping deeper. You're getting that restorative sleep. Your inflammation is coming down. Your waist, that spare tire, is going away. And you feel restored. Your energy level is back. Imagine that. And imagine that you're actually managing your blood pressure from the inside out and not trying to just press it down like a spring. Okay. You're tired of escalation. You're tired of feeling like your numbers are just being chased, and you want a comprehensive whole body strategy. Okay. Imagine that you do that and you actually do this and your plan works. Your blood pressure is not your enemy. It is just information that's saying there's something deeper going on. So when you respond to that information wisely, your body responds back. So fewer pills, stronger blood vessels, freedom from the escalation of medications. That future is possible. Okay. And it all starts with treating your terrain, that underlying issue in your blood. So I hope you guys got a lot of information out of this. Don't forget to like and share the video so many other people can actually learn that your blood pressure is not your enemy. And please, please, please reach out to me if you have any questions or concerns. www.dramandamd.com. And I look forward to working with you. Blessings and health, y'all.